Hi there, Mel here from Synthesis Health Lab, and today we are going to take a closer look at the first step of the cell danger response. So the cell danger response is a 3-step process that all cells go through whenever they are stressed by anything. And so in this video, we're going to take a closer look and see what happens at that first step, some of the symptoms that are associated with it, if we get stuck there, some of the diseases, and ways we can think about moving through. So let's get started. So chronic inflammation causes chronic disease. There's an increasing awareness of the pervasive role that chronic inflammation plays in pretty much all complex chronic illness. So for example, we see this review from 2019 that's looking at chronic inflammation in the etiology or cause of disease across the lifespan. And they link chronic inflammation to diseases as diverse as cardiovascular disease, cancer, diabetes, chronic kidney disease, non-alcoholic fatty liver disease, autoimmune diseases, and neurodegenerative disorders. And in this graphic from the paper, you can see how they connected different risk factors like chronic infections or physical inactivity through systemic chronic inflammation to these diseases like cancer, depression, and neurodegenerative diseases. The big misunderstanding, though, is that yes, chronic disease is associated with chronic inflammation, but chronic inflammation isn't just one thing. Chronic inflammation is a 3-step process that gets stuck at one of these steps to create chronic illness. Throughout the day, our mitochondria, when they're healthy, are responding to daily rhythms and seasonal rhythms of light and dark, warm and cold, activity and rest, feeding and fasting. But when we have a stressor, whether that's infection, new information, an injury, poisoning, any sort of stressor, then the cell will leave the health cycle and enter the healing cycle until it's complete, and then it can re-enter the health cycle. And so when it does that, it goes through CDR1 or cell danger response 1, CDR2, and CDR3 before re-entering the healing cycle if all goes well. The triggers of the cell danger response are very diverse. Our cells evolved 3.5 billion years ago, and so they have a limited way of responding to stressors. So whether it's mycotoxins or trauma, infection, stress, pesticides, or medications, the cells will respond quite similarly. When a cell is injured, it releases chemicals that signal distress and begin a biochemical cascade in order to take care of the threat and return the cell to a healthy state. Classically, we tend to call the symptoms that are associated with this first step inflammation, and a lot of strategies are trying to prevent this. The mitochondria shift modes from power plants or generating energy from fuel to battleships and attacking and defending. There are a lot of biochemicals involved in this response, but the key signal that coordinates all of this is ATP, or adenosine triphosphate. This is the body's core energy currency, and when it goes from inside of the cell to outside of the cell, then that is a classical trigger of the healing cycle and the inflammatory cascade. So this response that cells have is really similar to the strategy of using a backfire to prevent forest fire from spreading. So it creates inflammation, and it basically creates this oxidative shield to protect healthy tissue on the other side of it. When the cell danger response is triggered, then cells drop out of being integrated in the network and resume an identity of being like a single-celled organism. So in the first step of the cell danger response, cells tend to take on the identity of a single-celled organism from 3.5 billion years ago. And interestingly, bacteria from that time had a similar mechanism when they were stressed, that they also leaked extracellular ATP out of their cells to trigger healing. The purpose of CDR1 is defense, damage containment, innate immunity, and repair, but this is at the expense of normal tissue function. So here we can see how cells and mitochondria change modes and change metabolism as they're going through each step of the cell danger response. So when there's a trigger that we can see up here, then cells shift from what's called an M2 mode, which tends to be thought of as an anti-inflammatory or healthy mode, into an M1 mode, which tends to be referred to as a pro-inflammatory mode. But now you can see and understand why this is. And so connectivity will decrease as injured cells want to focus on boots on the ground information. They're less interested in signals coming from other parts of the body. Cells in this mode will reduce their oxygen consumption. This is partly as protection because if there's a cut, for example, then cells can't rely on blood supply to deliver oxygen, so they need to be able to function in a low oxygen environment. The vagus nerve becomes less active, and this is also to help increase inflammation because ultimately inflammation is part of how cells and tissues heal. And you can see that extracellular ATP goes up just like we'd expect, that when you cut something open, the inside pours out, and this is how cells coordinate with the surrounding tissue to let it know that there is a threat. So some of the shifts that we see in metabolism of the cell in the mitochondria is that the ATP leaks out as a danger signal. And within minutes, mitochondria change shape and metabolism into pro-inflammatory battleships. And the mitochondria become punctate, or like little separate meatballs. So mitochondria can exist on a spectrum between being quite connected, like in these like thread-like filaments, like this kind of thread-like webbed network, or they can be quite separated, and that's called punctate. And so this range of mitochondrial shape is referred to as being either in the spaghetti or the meatball shape. And so when cell danger response 1 is triggered, then the mitochondria tend to become meatballs, and this is part of how they heal. They do this so that they can go through the steps of healing. Less oxygen is consumed for energy and more is used for reactive oxygen species defense. So you might hear that reactive oxygen species or oxidative stress is bad, and this leads to a recommendation for everyone to take loads of antioxidants in order to be healthy. But again, this is actually just a tool that can be leveraged in protection and defense of you. It also protects cells when blood supply is cut off. And oxidized molecules trigger something called the NLRP3 inflammasome and other inflammasomes. And again, these are just inflammatory cascades that are all developed over millions and billions of years to help protect and then heal the organism. Cells become autonomous in order to heal, and metabolic communication and cooperation between cells is suspended. Platelets and neutrophils are recruited to the site of injury or infection, right? So blood clotting goes up, which makes sense. So if we are fighting with the proverbial tiger and we get cut, then we don't want to bleed out. So when cell danger response 1 is triggered, then clotting should increase. The shift in energy production gives off heat locally from uncoupling, and this is one of the classical signs of acute inflammation. Centrally, the brain may create a fever and make you want to withdraw, lie down. And that makes sense. This is partly to conserve resources for healing, and also because if you have an infection, for example, you don't want to give it to other people, and you also don't want to be exposed to more stuff while you're already run down. So there's a certain behavior that gets translated up from the cellular mitochondrial level up to you and how you feel. And the heat that's created by this process increases something called heat shock proteins, which are known as chaperone proteins. These are proteins that help other proteins fold more accurately. So this is a really helpful thing and can prevent certain neurodegenerative diseases and other chronic inflammatory issues. Extracellular ATP triggers the release of cortisol from the adrenals. So many people have heard that cortisol is a stress hormone and that it goes up when we're stressed and it's bad. And yes, cortisol is meant to be part of a short, acute stress response. And when it's chronically elevated, it can cause problems. But the thing to understand is that cortisol is highly anti-inflammatory, which is partly why industrial medicine likes to rub it and inject it into things to lower inflammation. But we produce it in order to protect healthy tissues from damage from the inflammatory process while we are fighting infections from bacteria or viruses or from healing tissue. This is an example of a lab test on one of my patients in my practice, and you can see here that her cortisol levels are highly elevated. So up here, her total cortisol is like twice the upper limit, and she's producing more cortisol, the active form, rather than the inactive form of cortisone. And the way that most functional medicine people are trained is to say, oh, this person's stressed, this is really bad, let's give her things to lower it. But if we understand why her body is doing this, and in this case, her body is producing lots of cortisol to protect her tissues from damage. In this case for her, it was from a high mold exposure. Then rather than try to interfere with the way the body is trying to protect itself, we can focus on helping her remove the trigger of the cell danger response, which in this case is mold, and then allow the cortisol to come down on its own, which is what we did. Now, some other shifts that are interesting: vitamin D is inactivated in CDR1 in order to create stronger inflammatory response. So there's an increasing awareness that low vitamin D levels are associated with all sorts of chronic illnesses, and that's completely valid. Part of that, I think, has to do with a general lack of healthy summer sun exposure that most modern people have. But the other issue is that when people are chronically inflamed, the body is lowering this intentionally. And so just taking a vitamin D supplement and even trying to normalize levels is unlikely to be a complete solution for the majority of people with complex chronic health issues. In this mode, fatty acids are used to make more inflammation. So again, we're seeing a reason why fatty acids might be anti-inflammatory for one person and pro-inflammatory for another person. There's a few reasons for that, but one is that if someone has a lot of mitochondria in a CDR1 mode, then fatty acids are going to increase inflammation. And vagal tone decreases. So that's the activity of the vagus nerve, which is the longest nerve in the body, and it's associated with that rest and digest relaxation part of our autonomic nervous system or our automatic nervous system. But when we are faced with a trigger or a threat that triggers off cell danger response 1, our body intentionally lowers the tone of the vagus nerve. And this is just a quote from one of Bob Navio's papers, the key discoverer of the integrated cell danger response. He writes, "The decrease in and restructuring of cell-to-cell communication represents a kind of cellular autism that is not just beneficial, but required to initiate the healing process." However, because organs require tight cell-to-cell communication and coordination for optimum function, this disconnection of cells from the whole comes at a cost. Normal organ function is temporarily decreased while cells pass through the steps of healing. So this can be really helpful to understand that, most people, like if you have a complex chronic illness, there's so many pieces to try to untangle, and it's really hard to know where to start. And even with clinicians, people don't have a good understanding of the organizing principles of what's going on with their patients. And so you might sense some of these things going on, but if we understand what the body is doing and the timing of it in terms of your unique stressors, then we can work with the body to help support it towards healing. So some common conditions that are associated with someone who has a lot of cells and tissues that are stuck in a cell danger response 1 mode are allergies and atopic conditions, histamine intolerance, and really just any sort of overproduction of histamine. So if you're someone who, when you get a bug bite, completely swells up and gets red, then that's a CDR1 response. Hives, asthma, some types of migraines. Cytokine storm is an escalation of cell danger response 1, and also chronic infections where we just can't get the upper hand and get past the chronic infection to get rid of it or to help it stay in remission. So now that we understand what's going on with our cells and our tissues at the microscopic level, let's take a look at some problems with common approaches. Industrial approaches, and increasingly a lot of natural approaches, focus on blocking inflammation. They're blocking the first step of the cell danger response, categorizing its symptoms and biochemistry as pathological rather than the first step in an evolutionarily adapted, orchestrated healing response. And of course, this response can get out of control and fevers can get too high, and at the extremes there can be too much, but within a healthy range, it is a really healthy response to the body. So for example, there's a lot of guidance around icing injuries, but research shows that this impairs blood flow and transport of inflammatory chemicals. It prevents the release of a chemical called IGF-1, which is really important for tissue healing and remodeling. And overall, it delays tissue healing. So icing might reduce pain and it might reduce swelling, but people will have their injuries longer because of this approach. Non-steroidal anti-inflammatory drugs are shown to delay tendon healing and delay bone healing. But interestingly, we see that this effect partly has to do with when the ibuprofen is given. So in this study on mice, they found that if the ibuprofen was given early after injury, then it was detrimental to tendon healing. While if ibuprofen was given later, then it didn't have an effect on tendon healing. So this makes a lot of sense. If we understand the healing cycle and we understand how things get triggered and then this orchestrated cascade happens, then early administration blocks that initial signal from helping you gather resources for healing. Whereas if there's a delay, then that effect is less. Looking at reducing fever, we see that research shows that in animals infected with the flu, reducing fever was associated with a 30% increased risk of death. And interestingly, a paper came out in 2020 looking at the use of ibuprofen to treat fever in COVID-19. They wrote, fever has been shown to be beneficial toward a reduction in the duration of viral illness and the mortality associated with illness. Outside of reducing patient discomfort, there's little evidence to support administration of antipyretics to reduce fever results in better overall outcomes in previously healthy patients. To the contrary, in several studies, the use of antipyretics has been associated with an increase in mortality and morbidity, so death and illness. It is therefore a concern of whether these agents may suppress the natural mechanism of the body to fight infection. This review article is looking at this inflammasome that I mentioned earlier called NLRP3, which is part of the innate immune response of cell danger response 1, and it's looking at what activates and inhibits it with a view of developing drugs to inhibit it. So it says that the dysfunction of NLRP3 inflammasome activation is implicated in a variety of human diseases. But what I'm going to say here is that that's not dysfunction. That's it working exactly as it's meant to. The NLRP3 inflammasome can trigger inflammation by sensing a wide range of stimuli, but the specific mechanisms are still unclear. And I will argue that if they look at extracellular ATP, they will find a specific mechanism. Understanding the mechanisms of NLRP3 inflammasome activation will boost the development of its specific inhibitors to treat NLRP3-related diseases. And what I can tell you is that if they start to do that, they will see that they're probably able to reduce signs and markers of inflammation, but that they will delay tissue healing. And now, quickly just looking at biologics, these tend to be injections and medications given in the treatment of various inflammatory disorders, including autoimmune illness. And Humira is an example. I think that's the number one grossing drug in the world. So these are TNF-alpha inhibitors, interleukin-17 inhibitors, interleukin-23 inhibitors. These are all messengers of cell danger response 1. And what we see is the safety issue. This particular review is looking at the efficacy and safety of biologics for psoriasis and psoriatic arthritis, but these are used commonly in other diseases as well. And they found it has been reported that TNF-alpha inhibitors are associated with serious infection, which makes sense, tuberculosis, paradoxical reaction, lupus, which is an autoimmune condition. Interleukin-17 inhibitors are associated with candidiasis, neutropenia, that's low white blood cells, and inflammatory bowel disease. This is another autoimmune condition. Safety concerns common in biologics include hepatitis B virus reactivation and interstitial pneumonia. So when we understand how the cell danger response works and that these biologics are targeting these key messengers of this first step of the healing process, then these other effects of the drug start to make a lot of sense. So what all of these approaches have in common is that they're trying to block CDR1. And so what we get is a short-term reduction in symptoms, but overall we get a blocking of the healing cycle. So a systems approach to healing would be to systematically identify, remove, and manage triggers. And here the key word is triggers, plural, because there's a lot of well-intentioned effort to identify the, quote, underlying cause, but the fact is that for the vast majority of people, especially with complex chronic illness, there's more than one trigger. And it's not a simple matter of running a test and finding mold or finding thyroid antibodies or finding a high cortisol. We need to systematically go through and find all of the triggers and remove the ones that we can and improve the body's ability to respond healthily to the ones that we can't get rid of, because we can't get rid of all triggers, but we can improve our resilience. And then support the body through stages of healing using a step-by-step approach, working with how it evolved to heal. And so what this looks like in practice is for healing complex chronic illness that we start by supporting the immune system to handle chronic infections, biofilms, mycoplastics, all the things that are triggering off the cell danger response in the first place, right? So we're not going to, people want to, increase micro blood flow or top up B vitamins, but if the body's on fire, then we kind of need to support it there first. We then look at repairing and restoring the digestion, which also plays a really important role in our immune system. Then we look at reconnecting these cells. So this is cell danger response 3, where new healthy cells now need to rejoin the network so everything can work together. And then not all chronic diseases are associated with tissue damage, but for those that are, at this time we can start to look at increasing healthy blood flow, but now we are increasing the flow of healthy blood, not infected and polluted blood. So in this more evolutionarily compatible approach, rather than trying to block the first step of this healing cycle, we're actually trying to systematically remove the stressors and support the healing cycle to complete. So we're removing the stick in the spokes that's just blocking the healing cycle from completing and allowing it to complete, and doing practices that support it moving forward in the way that it wants to anyways. Most approaches to healing complex chronic illness fail because they either try to block the healing response or they go out of order. By removing blockages in the healing cycle and supporting the body to resolve its response, we can systematically heal from complex chronic illness. So that was a look at the first step of the healing cycle, the innate immune system, and what happens when we get stuck there. And in the next video, we're going to look at the second step of the healing response, which is to replace the damaged tissue by growing new tissue, and the symptoms and diseases that arise when we get stuck there, and look at how we can understand those so that we can get healthy. So I look forward to seeing you in the lab. Take care.